A civil rights lawyer from New Albany. I really appreciate it. And I became a lawyer in part because I'm not good at math. And nonetheless, I want to talk to you because I'm okay with getting outside of my comfort zone. That's why I'm running for Congress. I want to talk to you about numbers. And there's a couple of numbers here. You don't have to be a math genius to understand what's going on numerically with regard to care in the United States. Understand that it's bad, and it spells big trouble for all of us if we don't turn this ship around now. And by the way, I echo what Dr. Stone said. I'm excited to see you all out here. We wouldn't have had something like this 10 years ago, and it shows that the seeds of change have been planted. So just keep on growing those seeds. But the first number I want to talk to you about is 17%. 17%. Who knows what that means in the context of healthcare? Right, 17% of our GDP, that's what we spend on healthcare right now, without a single payer system, more than anybody. And what that ends up being over a 10-year period is about $49 trillion. That's a lot. It's a lot. It's more than a single payer system would cost us. So when people tell you that we can't afford it, that is a desperate, sick lie. That's a lie. Don't let them tell you that. This is not a question of affordability. It's a question of priorities. And we've got to get our priorities straight in Washington. And that's why I'm running and why all these people up here are running. The other number I want to talk to you about is 500,000. In fact, more than 500,000. That's how many medical bankruptcies we have in the United States every year. More than 500,000 because people can't pay their bills. And you think we're not paying for that already? You think we're not already paying for that? We're already paying for healthcare, folks. We're already shelling out for healthcare. We're just doing it very badly. So don't let anybody tell you that we can't afford it. That's a lie. Next number is 30,000. In fact, more than 30,000. According to some studies, that's the number of Americans that die every year because they don't have insurance. Because they don't have access to medical care. They just don't have the money in their bank account to get the services they need. And that's abhorrent. I mean, can you imagine? What other country does that to its people? And if you don't believe that the human cost alone associated with that number is worth going to single payer, the economic cost ought to convince you, right? And should convince our friends on the other side. We pay for that. We already pay for it. One last number I want to talk to you about. 129.3 million. Who knows what that is? Take a guess. That's the compensation paid to 8 people that are CEOs of health insurance companies last year.
Shame on you. Stop.
While 30,000 people die because they can't get insurance. 500,000 people go bankrupt because they can't afford their medical bills. We paid out $129.3 million to 8 people who profit off the sick, who profit off the dying, who profit off the dead. Well, folks, I think you know, and you wouldn't be here if you were all about numbers, right? This is more than numbers. This is more than about Congressional Budget Office scores. This is more than graphs and pie charts and equations. This is about people. This is about people, and we care about people, and that's why we're all here. We care about our neighbors. We care about our friends. We care about our families. We care about our communities. Numbers has nothing to do with dollars. And so I think it's time we tell Washington that the only number we need to talk about is not one more. Say it with me, it's cleansing.
Not one more.
How many more medical bankruptcies are we going to allow?
Not one more.
How many more people are we going to allow to die because they can't pay a bill?
Not one more.
How many more dollars are we going to put into the pockets of billionaires who profit off the sick and the dying and the dead?
Not one more.
That's right. That's right. It's not enough to overhaul the ACA. Remember that. It's not enough to just fix the ACA. It's not enough to just provide people with insurance. It's not enough to just fix it little by little by little. Right? We've got to demand health care as a basic human right. You've got to say it, because that's how rights work. I'm a civil rights lawyer. Trust me on this. This is how rights work in America. You have to speak those rights into existence. If you don't say that you have a basic human right to health care, nobody's ever going to believe it. You have to say it, you have to believe it, and we have to let Washington hear us. And if Washington doesn't hear us, well, if our elected representatives don't hear us, if Mr. Hollingsworth III, not T. Hollingsworth, he seems like a good guy, but if Mr. Hollingsworth III won't listen to us, well, isn't that the job that he got hired to do? And what do you do about somebody who doesn't do the job you hired him to do? Fire him, and that's what we're going to do on November 2018. I love you all. Keep fighting this good fight. We're going to win.